So our next speaker today here in person is Huntriss. Ro is the UK's leading fertility dietitian with a bachelor's degree in food studies and nutrition, a postgraduate diploma in dietetics, and 2 master's degrees in both advanced nutrition and clinical research. She's a researcher, a published academic author in the field of fertility nutrition, and a clinician with 12 years of experience working as a dietitian. Ro is also regularly featured in mainstream media outlets such as BBC, Forbes, Women's Health, Men's Health, Cosmopolitan, and Hello magazine. Ro is a founding member and vice chair of the Maternal and Nutrition Specialist Group of the British Dietetic Association and is passionate about sharing evidence-based information to support women and men on their journey to conception and beyond. Ro is an award-winning dietitian, having been titled Social Media Influencer 2022 by the British Dietetic Association for her work around fertility nutrition, and was awarded CN Magazine Community Nutrition Professional of the Year in 2021. Ro published her first book on the topic, Deliciously Healthy Fertility, in March 2023 this year, and offers a fertility nutrition course for healthcare professionals for those looking to upskill in this fascinating area.
Thank you so much, and guys, I'm really happy to be here today and to talk to you about a subject that I am really passionate about, and I hope that some of you might be feeling a bit more passionate about this area by the end of this presentation. So we'll get to the important bit first, Instagram. So if any of you are there, you can find me at Dietitian Ro, but more fitting for today, I have a page at fertility.dietitian.uk where I share exclusively stuff around fertility nutrition. So the science behind it, but also kind of patient testimonials, their journey. So yeah, if you're interested in the topic, definitely go and check it out. And if you're interested as to how a fertility dietitian works, what we do, check out my website, which is fertilitydietitian.co.uk. So, for those of you that don't know me, my name is Huntriss, and today I'm speaking to you in my capacity as a specialist fertility dietitian. So, before we get to my work history, it's very important that I give you my Yorkshire history, because we are here today at the BDA Yorkshire Specialist Group event. So, I have quite an impressive Yorkshire history, actually, I think. So, started back in 2005, so I've moved here, I'm from Chester originally. I moved here in 2005 and I did my food studies and nutrition undergrad at the University of Leeds. I then, and I know some of you are doing this as well now, my PG dip in dietetics at Leeds Beckett, which I then did the masters with Leeds Beckett. I did my Band 5 in Mid Yorkshire, Band 6 as a diabetes and weight management dietitian in Bradford, and I lived in Leeds until the end of 2019. So a pretty impressive Yorkshire CV, I would say. But now I live in London, and I think you guys might, there we go. So what I do now, so you'll see stuff that I do on Instagram and various things. So I've always had employment alongside my self-employment and everything else that I do. So I've always had a full-time job alongside everything that I do initially. So where I work at the moment is within a company called Palter, and they own a portfolio of different health and wellness apps. So one of them being the Simple app, which is kind of like around weight loss, but it's also got in the portfolio Flow, which some of you might be familiar with. It's had 250 million downloads across the world, which really shows the scope of it, and that's one thing that I really love working in. Tech, because the accessibility is huge. So I work there as the Chief Nutrition Officer, but about me and my role in fertility nutrition, so we've got other fertility dietitians here and there may be some more in the room, but we are representing an underrepresented field, and how and why I got into it was that I'm, full disclosure, 36, and when I was in my 20s, kind of like coming into my late 20s, friends were coming up to me and saying they knew that I was a dietitian. I'm struggling, I'm having difficulty having children, we've been trying for so long, what can I do? What can I do to my diet? What can I do with my supplements? And at the time, I was like, I can tell you the basics, but I can't tell you what supplement is best for you. Like, I don't know. But it was a real driver for me to go, okay, well, let's find out, because there's evidence out there, there's research out there, but there's not guidelines. We're not taught about it at university. So that was really kind of like my drive to go into this area. So as you heard before, so I'm now the vice chair of the BDA Maternal and Fertility Nutrition Specialist Group, which was only set up 3-4 years ago. And shout out to Kamal in the front row, who's our chair. And Kamal was the lady who was it was your brainchild. And we've had a great few years, haven't we? Kind of like trying to increase awareness around this topic of maternal nutrition as well. So we very much like doing that. And then I have my little own platform, so Fertility Dietitian UK. I've already mentioned about my Instagram, but basically at the core of what I do is evidence-based fertility nutrition. So what you'll find when you go online and then you see fertility nutrition is you can find a lot of nonsense from anybody who wishes to spurt it. So obviously as dietitians, we have to share evidence-based or we'll be chucked off the register. So, you know, that is exactly at the core of everything that I do. And then, so in that, patient services a lot, because I love the digital world, virtual clinic that somebody kind of like helps me to deliver, and then e-guides, online courses, etc. And I do an online course for healthcare professionals as well. So I will touch on that at the end, just in case anybody is interested. Okay, so let's talk about what I'm going to be talking about. The session outline. So I'm going to give you an overview of the basics of reproductive health in relation to fertility. We'll be discussing the different stages of successful conception required to reach a healthy pregnancy and delivery. I'll give an overview of how nutrition can influence fertility, talk a little bit about continued education, and I had a bit of a lull when writing this, my top tips for new and old, I consider myself old, dietitians. But basically my reason for adding that was that, like, I've done the journey that lots of students have done, so I've added just a few tips at the end, things that I would have liked to know when I was a student that, you know, I figured them out in the end, but, you know, would have been useful to know earlier. And then if Christian's got any questions at the end of it. Okay. So let's just go for some definitions. So what are we talking about here? So what is fertility? So fertility is the ability to conceive. And there are several factors, both modifiable and non-modifiable, that can affect our fertility. And we'll be speaking a little bit about that on the coming slide. So then what is infertility? So infertility is defined as the inability to become pregnant after 12 or more months of regular unprotected sex. Now, it's really important to highlight at this point that infertility does not mean that somebody can get, it doesn't mean that they can't get pregnant. It just means that they haven't done to this point. And it's really important to have those conversations. So then what is unexplained infertility? These that we're coming on to now, these don't get as much press. These are talked about less. So unexplained infertility accounts for 1 in 4 cases of infertility, and it's when no cause for the inability to conceive can be identified in either partner. And to be honest, this one is a really, really frustrating one, because often we just say, okay, what is wrong? Give me a diagnosis, I can work on it, or it just makes sense. And then when people are in this category, they're like, oh my God, you know, what can I do? And within this category, this is certainly a place where nutrition and lifestyle can be really, really effective, because sometimes it can be the thing that can lead them to, you know, to successful conception, but also it gives people something positive to focus on, and they know that they're doing something positive that can potentially really help them. Secondary infertility is something that also isn't mentioned that often, and it's when somebody has had 1 or more pregnancies in the past but is having difficulty in conceiving. And this group, again, they get less attention, and the emotions that they feel can be just as raw as somebody suffering from primary infertility. So I just think it's important to be aware of this group and ensure that we're giving this group adequate care. So just in terms of some statistics. So around 1 in 7 heterosexual couples may have difficulty conceiving. 84% of couples will conceive naturally within a year if they have regular unprotected sex, so around about every 2 or 3 days. So these are some NHS stats for you. So, so then coming over here, so when it comes to fertility, the emphasis tends to fall on the woman. Society kind of puts that responsibility on the woman, and then the woman assumes this responsibility as well and carries it on her shoulders. But it's important that we have a discussion around the actual statistics. So roughly 35% of infertility cases involve only women, 20% involve both women and men, 30% involve only the part on the male, and then 15% of infertility cases remain unexplained. So basically, what this is saying is it's not far off 50-50. And that's another conversation that we need to make sure that we have. Okay, so then, and this is just like an insight as to some of the things that can affect fertility. And again, this isn't exhaustive. But you can see on the left-hand side here, there are lots of things for women that can get in the way of fertility and successful conception. So we've got many health conditions, so PCOS, endometriosis, thyroid problems, etc. We can have issues with ovulation, ovulatory disorders. We've already heard from Claire this morning, and PCOS, and we know that ovulation obviously plays a part there. Celiac disease. Undiagnosed and untreated. Kristen and I have done like a little bit of work on the awareness of that, which people aren't necessarily so aware of. But then other things like low ovarian reserve, so and things like blocked, damaged, scarred fallopian tubes. So as you can see here, if you've got a blocked fallopian tube, I can't tell somebody to go and eat like 10 carrots and it's going to unblock their fallopian tube. You know, we know that nutrition doesn't work like that. Sometimes medical intervention is required. It's important to highlight that nutrition is not going to solve every fertility issue. But actually, for many here, it can really help. We know in terms of the management of certain conditions, we know it can support ovulation, we know celiac disease, and there are some things that could even just promote a healthy ovarian reserve or prevent a sharp decline. As we go over to the right, things that can affect men, so damaged testicles, varicoceles, ejaculation disorders, and health conditions like diabetes again, and then things like sperm quality. So when we look at sperm quality, things like sperm count, concentration, motility, morphology, DNA fragmentation, there's so many different things that can go on there. Now, things that we've got here, there are some things that with medical intervention or with diet and lifestyle, we can improve. We can improve, we can manage, in some cases we can resolve. Sadly, the bit in the middle, we cannot change. I would love to be able to reverse age, but I haven't figured out how to do it yet. So, age and genetics, they're just things that happen. We know that fertility declines for women as they age, but also lesser known, it does actually decline for men as well, and it can often come in terms of the altered hormone levels, reduction in sperm quality as well. But as you can see, there's a lot going on here, and there's a lot going on in the jigsaw of fertility. But what we can focus on is that there are so many different lifestyle factors that can influence fertility. And these factors can influence some of the things that you see here. But in general, what we know is that a good diet and lifestyle can increase the probability of pregnancy and live birth, and it can reduce the amount of time that it takes to get there. So just to go through those factors, so diet, supplements, caffeine, smoking, alcohol, stress, activity, and weight can all play a part. Okay, so then coming on to menstrual health, and this can be a really good place for people to start when it comes to understanding their fertility. So just as a question, how many people in the audience use some kind of cycle tracker? So probably, if not more than half. And that's, you know, that's a really, really positive thing. And I suppose you'd expect maybe for our profession, we may be more likely to do something like that. But it's a really, really good place for a patient. If they're wanting to understand their fertility, it's a really good place for them to start. So why is it important? So the interplay between our reproductive hormones is crucial for the correct functioning of a woman's menstrual cycle and the chances of conception. If hormones become imbalanced, this can affect the control of one's menstrual cycle and their ability to successfully conceive. So here, we have basically an example cycle, and you'll often see that the average cycle is 28 days, and just take that for what it is average. So there are shorter cycles, which is normal, there are longer cycles, which is normal, so it's really understanding, you know, what is normal for you. But taking this average cycle, so on this 28-day cycle, you've got your follicular phase for the first half, and then you come into your luteal phase. But what happens, so like day 1, so this is kind of like the menstrual cycle at this point. And then at day 14, this is when ovulation occurs. So what that means is the release of the egg. And then at this point, that is when the sperm can fertilize the egg. And then in this luteal phase, this is where implantation can occur, which can then lead on to a pregnancy. So if by the end of day 28 and then you're coming into day 1, if a period then occurs, then it means that pregnancy has not happened. If the period doesn't come, then that's obviously the indication that that pregnancy has then resulted. So why is this important, and what is the fertile window? So this is sometimes something that you'll hear, but basically this period here, so kind of like around about the 5 days up to ovulation and then the day after, this is the most fertile window of a woman. So obviously a kind of like an effective, if you like, time for intercourse to take place to increase chances of pregnancy. So just even in terms of the basics, these are really useful conversations to be having with patients. Okay, do you know your cycle length? Are they regular? When may your ovulation be if we're looking at things like this? And then people can actually track ovulation in other ways. So in terms of changes in cervical mucus, basal body temperature, increased sex drive, ovulation pain, changes in cervical position, and then some people may do ovulation tests as well. But why is this important? So ovulatory health is a big part of fertility management. Ensuring healthy ovulation should be a key focus for dietitians. Without ovulation, we can't have pregnancy, naturally. So ovulatory issues account for 25% of infertility cases in women, and understanding one cycle in the fertile window can certainly increase chances of pregnancy. So when, in the context of, say, like fertility dietitians in the NHS, what tends to happen is patients may get referred for weight management, and weight management can certainly help. And you know, with anovulation, you know, when ovulation doesn't occur, this can be as a result of low body weight and also high body weight as well. So it's just to, you know, highlight that weight management is a part of fertility management, but it's not everything. Okay, so let's have a little look at a fertility-friendly diet. And it's nice because I'm seeing lots of kind of continuums throughout today, but here we feature the Mediterranean diet once again. But it really is a fantastic foundation for a fertility-friendly diet. And that is in the context of studies that have looked at the Mediterranean diet as a whole, but also diets and studies looking at the kind of like the individual components of the Mediterranean diet and their effects on fertility. So what does some of the research say? So we know that it incorporates lots of fertility-supporting nutrients and can help to promote a healthy weight. Research has shown that women adhering to a Mediterranean-style diet have an increased probability of pregnancy. One paper showed that a Mediterranean diet was associated with a 40% increased probability of success in achieving pregnancy through IVF, which is huge. And if anybody knows, you know, people that have gone through IVF, it is such a challenging process. But if diet is ignored, we're missing out on a huge opportunity here, and it can have, you know, significant impacts. We also know that diets deviating from this, such as diets lower in green vegetables, fruit, dairy products and fish, can increase the risk of miscarriage. So it's really important. Fertility work doesn't stop at pregnancy, because a lot of the patients that we see may have suffered a miscarriage or may have suffered recurrent miscarriage. So actually, that's when I say about supporting them to conception and beyond. Our job is not done at that point. But also, let's not forget the men. A Mediterranean diet is associated with significant improvements in sperm quality, including sperm count, sperm motility, and sperm concentration. I think I probably don't need to be on this slide for too long, judging the audience, but we know the principles of a Mediterranean diet. We also know the principles of a general Western-style diet and the diets that we may see, within the UK, amongst our patients. But basically, what we need to think of on this slide is, if somebody's like, okay, well, where can we start? A really great starting point is, we just want to kind of like move from there to over here. So some people love the granularity of, okay, what does this nutrient do, that nutrient, how can we target this specific? And the thing is, there are things that you can do like that in fertility. For some people, that's really overwhelming and they need to start from the basics. So it's really, really simple, but just moving over to this can have significantly positive effects for both men and women. Some stats, because I love a good stat, who doesn't? So a couple of papers. So Chivaro, it's kind of like one of the key fertility papers, so do check this one out if you want to know where kind of like a lot of the kind of like the general guidance has come from. So for fertility nutrition. So for following a fertility-friendly diet has been shown to reduce the risk of ovulatory infertility by 66%. I've already told you this one, but I'm going to tell you again because I really like it. Research has shown that a pro-fertility diet can improve the chances of IVF by 40%. And research has shown that not following a fertility-friendly diet can be the cause of infertility in up to 46% of cases, and this is in one particular study. Okay, let's get into the nitty-gritty. So, as I said before, we've spoken about like the general approach when we come to fertility nutrition, but people will come to you and they'll want to work on a certain area. So, okay, I want to work on egg quality, for example, and it's actually a very, very common thing that people will want to optimize. So, let's talk about it. So, a woman is born with all of her eggs, so roughly around 1 to 2 million. But by puberty, this is reduced to 300,000, and each month there is a continual decline of eggs until the menopause. So as well as the quantity, the quality of women's eggs decrease as they age. As we said before, we can't change our age or our genetics, which do influence our egg quality. However, our diet and lifestyle can influence the quality of the egg as it develops. Now, the egg takes around 90 to 100 days for an egg to mature and ovulate. So what that means is it's a huge window of opportunity to influence the health of the egg. And that really, when people say about, because people can come like 2 weeks or a week before an egg retrieval, what can I do? I was like, oh, it's a bit late. But, anything positive is positive, but ideally, this time frame is ideal. And again, it's kind of, because some people be like, oh my God, I've had a terrible diet for 5 years. Fine, that's the past 5 years, let's focus on the next 3 months. It's kind of like another empowering thing that we can work with them on and say, don't worry, what matters from here, we can only control the present and the future, so let's go. So, a key reason for the reduction in egg quality is as a result of oxidative stress, and you guys will understand this very well. So we obviously want to think about how we can reduce exposure to triggers of oxidative stress, but we can also optimise antioxidant intake to counteract damage to the cells. So we know that the Mediterranean style diet has lots of antioxidants in, so one of the reasons that it is great. But also there are some key antioxidants to focus on. Vitamin C, vitamin E, selenium and zinc have all been shown to be key antioxidants with regards to fertility. But other nutrients that have been shown to support egg quality include folate, omega-3, and coenzyme Q10. So just going to have a show of hands, who's heard of coenzyme Q10 as a supplement? The majority. And you'll find consultants will recommend this supplement as well, but there is a good amount, a reasonable amount of evidence in terms of its effectiveness. But in terms of coenzyme Q10, it's a powerful antioxidant, and we have our own levels of coenzyme Q10 in our body. But as we age, the levels decline, so it can be particularly useful, say for example, in women who are trying to conceive over the age of 35. Okay, so on to sperm quality. As we said, male fertility can account for up to 50% of the cases of infertility. It shouldn't be ignored, but it often is. Men can be more difficult to engage and are often onboarded by their partner. And on my Instagram page that I mentioned, you can look at the statistics. 97% of my audience on the fertility page are women. The majority, whenever I get an inquiry from a man, I'm like, yay! But the majority are women. We have a guide on sperm health, and the majority is women buying it for their husbands. So we've got some work to do, but even in the social space, because it is really powerful, there's more and more pages that are coming up, and men who are fertility or infertility advocates, and that voice is growing, which is great. And I want to kind of take it as a responsibility to try and advocate for the role and the influence of nutrition in improving male fertility. So yeah, let's see what we can do. So diet and lifestyle can have a significant impact on sperm parameters, and this is very, very easily found and seen in the literature. It's actually, and I'm sure Kamal will agree with me, it's incredible actually the jumps that you can see in some of these parameters from supplement protocols, improved diet, etc. So it's really powerful. But nutrition can affect all of these factors. So count, concentration, motility, so basically the way in which a sperm moves, it needs to move in a certain way. Morphology, so the shape, so you've got your cartoon sperm over there, and that's pretty much exactly what we want them to look like. And then DNA fragmentation, so just about kind of the genetic integrity, if you like. But nutrition can support all of these things. Now, similarly, that we have with women, with men, it takes approximately 2.5 months for a sperm to mature and develop. So again, we've got this huge window of opportunity. So I see this as a really, really positive thing, and patients really like it too. Okay, so then we move on to implantation. So you have your egg, your nice healthy egg, you have your sperm, your nice healthy sperm. The sperm then hopefully fertilizes the egg and becomes an embryo. So this embryo then needs to implant in the uterus to then develop into a pregnancy and a healthy pregnancy. There are things that nutrition strategies can do to support implantation. So some of the things that we may want to focus on are creating a thick endometrial lining. So just to give you kind of an idea, so whole grains have been shown to thicken the endometrial lining, and vitamin E as a nutrient has also been shown to have this potential effect too. So when we're looking at this phase, and again, you can go with your patient on this journey, and earlier on it might be, okay, we're going to optimize egg quality, this is what we're looking at the moment. Then we move to this point, okay, this is going to be what we're focusing on now. So a thick endometrium. We also want to create a favourable uterine environment for the embryo prior to implantation. And some of this comes about in terms of ensuring that we're providing sufficient nutrition for this to happen and for the embryo to develop. Also, potentially supporting luteal phase progesterone levels. So there's limited evidence that some nutrients are associated with healthy progesterone levels. So it's not that we say, okay, go and take high dose vitamin C and it's going to do that to your progesterone levels. It's probably not, but it can help. So we want to just ensure that we have sufficient nutrients, such as vitamin C, vitamin B6, for example, to support healthy progesterone levels. And then things like supporting blood flow to the uterus. We need blood flow for the embryo to be able to implant. And I'm sure like lots of people have heard about the use of, say, like beetroot in sports nutrition because of its role in promoting blood flow. Similar kind of thing here. It can really help. So other things just to consider at this stage. So inflammation, which we've heard about earlier today as well, is thought to also play a key role at the time of implantation. If things are inflamed, you know, there's a lower risk of implantation occurring. So we want to ensure, where possible, a nice anti-inflammatory environment. Also, nutrient deficiencies can increase the risk of implantation failure, and to be honest, nutrient deficiencies can have issues at every single point of the fertility journey, and it's a really difficult one, like what we were speaking about with calcium before, because it's like, how do you know? How do you know unless you have that blood test? And I don't know, like generally I would say, you know, GPs, they can be good at like doing, you know, vitamin D, or, you know, might push them for B12, but sometimes, you know, it can be a bit of a fight. So when we see clients, there are certain nutrients, including those ones that I mentioned there, that it is really, really important to assess, because sometimes a nutrient deficiency can be the reason for somebody's infertility, and it can literally be fixed with taking a supplement to correct it. Okay, and then as I mentioned before, sustaining pregnancy. So our job is not done at this point. I always say I don't know if anybody else loves NHS Choices, but I love NHS Choices. I just think it's such like a great way of condensing the information that we need. But their advice in terms of foods to avoid when pregnant, I just think is a really, really good resource, and I always send patients there so they've got a really, really clear overview. But when someone is pregnant, they obviously need to be following all of this advice. But there is within the fertility world, there is a phase that's known the 2-week wait. So it's basically from kind of like ovulation until when that next period may be, because pregnancy could potentially occur in this time, but you don't know. So sometimes, you know, especially if people have had like fertility issues, you know, suffered recurrent miscarriage, or, you know, just infertility issues in general, we sometimes say you can follow this advice at that time, and even after embryo transfer for IVF, for example. But things that we know about, so minimising caffeine, no smoking, alcohol or drugs. We know that healthy weight is associated with reduced miscarriage risk, so you know, what can be done whilst caring for that patient and doing it in the right way, you know, can help. We've mentioned avoiding nutrient deficiencies, and as I just said, patients should or could eat like they are pregnant to reduce miscarriage risk, avoiding foods such as these, and these are ones that you can see obviously on the NHS Choices website. Oh, I will actually also mention there's a meta-analysis that's just come out in 2023, and actually at our study day, the maternal and fertility nutrition group, we've got the author of this systematic review, and it's looking at the influence of diet on miscarriage, and I think it's, to my knowledge, it's the first paper of its kind, but it makes associations in terms of those who have a higher intake of vegetables, fruits, seafood, like whole grains, have a lower risk of miscarriage. So it's a really nice paper. It's by Yilin Chung and colleagues, and it was done as part of some Tommy's research. So anyway, a really great paper that's just come out on that. And it's just great to see kind of like the emerging evidence that's coming out, and more research that's coming out in fertility and miscarriage in general. Then I'll just mention about fertility treatments. So there are several fertility treatments available to couples. Just in the interest of time, I'm not going to go through these in too much detail, but there's more than kind of like just IVF. But things that we focus on, they're still the same kind of principles. Similarly here, it is best to start working on diet and lifestyle at least 3 months before treatment for the reasons that I mentioned before. The dietary foundations, the Mediterranean diet is always at the core, but with like a moderate carbohydrate, as Claire said, and a higher protein intake can potentially be advantageous when it comes to IVF. But it is, and this isn't just for fertility treatments, but for fertility management in general, it's really important to think about things holistically. So we want to think about stress levels, because there is a link between stress and infertility, but it's a bit of like chicken and the egg, which came first. Regardless, we should try and manage it. Sleep, endocrine disrupting chemicals, which is a whole presentation on its own. But just at the basics, it's things like ensuring that your fruit and veg is washed to reduce pesticide residue, etc., because there is evidence that there are kind of links between high exposure and fertility problems. And then with, say, IVF, you want to kind of like focusing on the whole journey. So you want to look at egg quality, you want to look at sperm quality, you want to look at implantation, the 2-week wait, and then supporting pregnancy. So it's a real journey that you can support these patients through. Okay, and then just to stop it, as I'm kind of like coming towards the end, just to mention health conditions that can affect fertility. Diabetes, PCOS, endometriosis, thyroid issues, celiac disease, and this is very much at the core of dietetic practice. And by getting somebody's diabetes in check and getting their blood sugars optimised, that can optimise somebody's fertility. As Christy and I have done work on, with celiac disease, if somebody has unmanaged or untreated celiac disease, they can have issues with their fertility. What's the solution? A gluten-free diet. So as we would normally support these patients, just supporting these conditions can then go on to support their fertility. Okay, so I wrote a book. And you could call it self-promotion, but I think it's also really great that people, so I didn't pitch the idea of the book, the publisher came to me and they said, oh, fertility nutrition, it's kind of like a thing now. I was like, I know. And they're like, okay, well, we're looking for an author, do you want to write it? I was like, yes, absolutely. So the thing that I'm really excited about with this, it's just like, it's getting fertility nutrition out there, like, it's a thing now. And, I really want to start to see it, because I know so many people are interested in it as well. And, Kamal and I have spoken about, we'd love to see it a little bit more on the curriculum and, university curriculum. I think like women's health in general. And I think we are starting to see little bits of it as well. So fingers crossed that continues, but I certainly think we're moving in a positive direction. I did mention earlier that I also created a course, so a fertility nutrition course for healthcare professionals, and it was launched last year, but it was my goal to have it hopefully endorsed by the BDA, and it's just been endorsed by the BDA as of the 1st of June, and to my knowledge it's the first fertility nutrition education written by a UK dietitian that's been endorsed by the BDA. So again, I think the important thing here is that this field is being recognised, which to me is really, really exciting. But if you guys feel inspired today and you want to add this to your toolkit in terms of skills and knowledge and experience and apply it to your practice, you can use the code Yorkshire for 50% off, and you can find that on my website, which is fertilitydietitian.co.uk. So, okay, this is my very near the last slide. So these are my tips for those early on, but really at any stage of their career. So side hustles can lead to big things. And like ever since, so I started in the NHS in 2011, and then by 2012 I was like, right, give me something, I want something else, I want to do something else. So then I did all sorts of things. But then, I've always had a side hustle, and fertility remains to be my side hustle. But I just absolutely love it. and you can make it work. You can make, obviously you have to declare things to employers, etc. But like if you've got something that's a passion of yours that may be slightly different to what you're doing in your day job, do it, explore it, because it can lead to really, really good things. Don't be fooled by limiting beliefs. I remember at one point, like quite early on in my career, and I was like, right, okay, I'm here. So then in 3 years I'll be there, and then 10 years I'll be there, and then that's it. Okay, that's it. And then I thought, oh, that was totally not true. It's totally not true. Like you think that, okay, like that, right, that's where it ends. You can literally do, you know, anything that you want in any direction that you want. So believe beyond where you think your limitations lie. Don't be afraid to take risks. So I was in the NHS from 2011 to 2017, and then, has anybody heard of Oviva? Oviva? Yeah, so I was working in Bradford at the time, and then there was this position that came up. Aviva was kind of like in its infancy at the time, and it was like a temporary contract, and it was 3 years, and I was like, oh, but I'm in a permanent job. I'm in a permanent job, and then, you know, like holidays, pension, etc. And I was very, very like safe and secure. But this, and Aviva is digital health, and that was kind of like an emerging area for me. So I was like, oh well, you know, maybe it could lead to something, and it could lead to something good. And I remember the really bad advice that my mum gave me. She was like, "You'll regret it." I was like, "Thanks, mum, for the pep talk." But anyway, I went there, and then had an amazing time at Aviva working in digital health. And then, you know, I'm only in the job that I'm in now, which I absolutely love, because I kind of took that risk. So obviously, like, take sensible risks, but still, you know, risk can be a good thing. Seek out areas which you have a true passion for. I really think that I found mine in fertility, which you know, at uni I would have had no idea that I would be, you know, talking about this area, but it's an area that I absolutely love. So do seek them out. Follow prompts and take action. So just one final little example. So when I came to a Yorkshire branch study day, I don't even know, years ago, it was on research, and Judy Lawrence from the BDA, who's like the research officer, she shared about like the NIHR masters in like clinical research, which were like secondments, and I was like, oh, that sounds good. And then I went, and then I applied, and then I got it, and then I was seconded for a year, and then when I was at Aviva, I was working in research posts. I now do research as part of my job now. So it's just like, if you see something at a conference that like inspires you or you love, like go and look into it, because it could really shape where you want to go. So I think that's it.